Good afternoon, and thank you all for coming. My name is Jose Shapasnik. I'm the chair of the Department of Epidemiology and Public Health, and we're delighted to have you. It's a very exciting day. We have as our distinguished speaker, Dr. Jim Sallis. Dr. Sallis is Distinguished Professor of Family and Preventive Medicine at the University of California in San Diego. He, for those of you who know his reputation, he is probably known the world over as one of the top people in our field, in the field of physical activity. Mostly I know him for physical activity, but physical activity, nutrition, and its relationship to obesity. He has been director of the Active Living Research Program, which is a national initiative and a major investment of the Robert Wood Johnson Foundation on research to inform policy and environmental strategies to increase physical activity, decrease their sedentary behavior, and prevent obesity. He has received many awards. He has been on many editorial boards of important journals in our field. Among his many awards, he is the recipient of the 2010 Albert Johnson University Research Award at the University of San Diego. University of San Diego? San Diego State. And Distinguished Scientist Award from the Society of Behavioral Medicine, which is the international society in our field. He also received Distinguished Professor of Psychology recognition from San Diego State University, the 2011 Lifetime Achievement Award from the President's Council on Fitness, Sports, and Nutrition, the fourth most cited article in Research Quarterly for exercise and sport in 70 years. From 1930 to 2003, not exactly last 70 years, beginning back in 2003. His primary research interests are understanding policy and environmental influences on physical activity and nutrition, and the promotion of physical activity. We are delighted to have you all, and we're very honored to have Dr. Sallis here. Please join me in welcoming Dr. Sallis.
Thank you, Jose. Thank you all for coming here and being here for this little talk. Hope to make it interesting for you. We've been working together with Jose to try to find a time for me to come, and I'm so glad that I'm coming after your presidential, primary. So I don't have to deal with any of the ads that you guys had to live through. I'm sure that was very difficult. But it's a pleasure to be here, getting to know some of the faculty, seeing some great work going on, and I really appreciate your interest in this field of physical activity, built environment, and policy, and how we can make big changes in our society that are needed to improve physical activity. So I'm going to give you a bit of a tour through this area. And so this is what I'd like to deal with. I assume that you're from many different walks of life and interests. So I'm going to start out with very briefly why physical activity and why the built environment. And I want to focus quite a bit on the key lessons that we've learned from research on built environment and physical activity. That'll probably be the bulk. Also want to talk about what do we need to know? Where do we need to go next with research in order to inform planners, designers, and decision makers? And then a little bit on how can we get research used more in decision making. I've been in this field long enough that I've dealt with a lot of frustration that I think and my teams have produced really useful information that should be put into practice, but nobody puts it into practice. So So it's kind of like beating your head against the wall. And probably a lot of researchers have had this feeling. So we need to be smarter about how we use research and how we communicate it to people who can use it. All right, so there's really practical reasons for studying built environment and policy. That is because the Institute of Medicine, Centers for Disease Control, Surgeon General, American Heart Association, World Health Organization, National Physical Activity Plan, and other groups besides these recommend policy changes as essential for improving physical activity, diet, and obesity. All right? So they're all saying we have to make changes in our environments and our policies if we're going to solve these problems. Well, so we need research to inform these initiatives. And so the policy initiatives to change obesity-related outcomes are occurring all the time in government, school districts, and industries. And I know that there's a community transformation grant in Miami. I assume there was a CPPW grant as well. Do you know? Yes, yes. And so what were those about? Those were about policy, environment, and systems change, and partly for obesity prevention, right? Well, so it's the research. If we hadn't been doing this research, we and others haven't been doing this research for the past 10 years, there would have been no guidance for what does that mean to change policies and environments. So we need research to guide and also to evaluate these efforts. And for those of you not so familiar with physical inactivity, it is one of the leading problems in health today. This is in the US. This is a study published just a couple of years ago. Of course, we all know the ongoing carnage from tobacco smoking, still the leading cause of death. High blood pressure, close behind that. Overweight and obesity is a big killer of Americans, but also very similar number of deaths from inactivity. So most people know, yeah, physical activity is good for you. Most people don't know how important it is for health because it's related to so many chronic diseases, as well as mental health and quality of life. And so really very important public health topic. But we've had a transformation in physical activity over the past, certainly a couple of 100 years. So if you look at the left side here, this column, this is how people used to spend their time. And we call these domains of life. This is how we spend our time. Except for sleep, leisure used to be active. You know, we would go and see friends or, you know, dance as part of every culture, at least historically, maybe not so much anymore. Work used to mean work. You know, there's actual physical definition of work that somehow we have lost. Transportation used to involve these, your feet, right? We have feet for a purpose. We used to use them. Household work used to also be manual and take a lot of energy. But frankly, a lot of these things were not that popular.
Yeah.
You know, how many of you were lining up to do this kind of work?
Drastic.
None of you, right?
This morning was cold.
And so
it felt, you know,
we
yesterday
decided we wanted to use our brains more than our brawn.
Mm-hmm.
And so what is the Industrial Revolution all about? It's about labor-saving devices. And so for 200 years, we've been devoting our brains to reducing the need for our bodies. And let me tell you, it's worked extremely well. We've been very successful. And I call it the physical activity extermination effort. And it's almost completely done. Because look what's happened.
Did you go to that
Leisure has gone from this to that, screen time. Work has gone from work to screen time.
The week that I was out sick,
95% or so,
I was supposed to record that. It was
of all trips in the United States are done by car. All right, and which
Speaker.
I won't
Yeah.
I won't get to, but
No, I wasn't. I couldn't make it. I was supposed to
driving
record it. I didn't
is
make
a
it.
risk factor for obesity. That a direct risk factor for obesity. Household chores have gone from this to machines. Our homes are full of labor-saving devices, and so if you want to make a lot of money, you find ways to help people avoid physical activity. And that's historically been very, very successful. So really, we have engineered activity out of our lives. People have wanted that. We pay a lot of money to reduce our physical activity. So it's going to be challenging to reintroduce activity back into people's lives. And I think that, you know, we're not going to reintroduce it probably very much into all of these domains. Probably most people want to keep their washing machines and not go back to this. I don't think it's going to be too popular to take all the machines out of our homes. Occupations, I don't think the nature of work is going to change towards physical activity. Yes, we can do worksite programs to get people to walk in between, you know, walk on breaks or, you know, encourage them to be active outside of work, but I think work is going to stay about the same or get worse. So we're really probably focusing on leisure and transportation as the domains of life where it's realistic to introduce more activity. So, you know, if we continue on our present trends, this is my latest investment. So look out for that. So I just want to show you, you know, how are we thinking about physical activity? Well, and health behavior in general. Well, I was trained as a psychologist, and so I was trained to work in this box here, and thinking about how can we teach people, give them knowledge, attitudes, skills, make them feel better about being active, and that's important. But now you see that that's only a part of what we think is needed to change behavior on a massive and sustainable way. And so we're really looking at behavior settings. You see that this model is organized around the 4 domains of activity: transport, occupation, household, and recreation. And there's actually, we do these activities in different places, and those places are controlled by or affected by different policies. So we need to be very specific about the environments and the policies that are related to activity. But there's also the social and cultural environment that cuts across several of these levels. And so if you're from a culture that says, well, you need to rest as much as possible, well, we need to maybe deal with that. If none of your friends support activity, then we may need some social support interventions. If everything on the media is about sitting and nothing about being active, well, that's going to be a barrier. And speaking of the media, does anybody know the most advertised product in the United States? Not food, not medicine, cars. More than beer. Now, if you were watching the Super Bowl, you may not believe that, but cars. Cars are the most advertised product. $20 billion being spent every year to tell us how great it is and how sexy we will be and how powerful we are when we drive. No advertising to tell us how healthy we will be, how much fun we will have if we do physical activity. So a little bit of discrepancy in the social and media environment there. But we find we need a complex model like this to really think about what are our opportunities for intervention, how can we think about physical activity in a more sustainable way. And let's see. So one of the things about using a model like this, which we call ecological models, is that those of us who have been working with individuals for a long time and trying to motivate them and educate them, give them skills to change their behavior, find that most people don't want to be a part of a program, right? It's hard to get people into a program. Those that are in the program often change, but not in a major way. And those that change typically go back to where they were at the end of the program. So it's not really sustainable. But if you change a whole community, if you change a state law, then you're affecting most or all of the people in that community or that state, and probably over a very long period of time. So in fact, this changing laws and policies is a way to create a widespread and long-term change. And in fact, you know, a lot of us think we made a lot of mistakes with our environments and policies, and so those mistakes are having long-term effects as well. So let me continue here. So I think about an active living community, because if you think about it, we've gone in the physical activity field. We've gone from exercise, meaning okay, you've got to sweat, you've got to do it for 20 minutes at a time without stopping, and that's what exercise is. And then we said, well, actually, based on the research, you don't necessarily need to sweat. You don't necessarily have to do it for 20 minutes at a time. You can walk and get a lot of benefits. So then we thought, okay, we're going to talk about physical activity because it's a wider concept. Now we talk about active living because you don't have to put it into your leisure time. You can do it as part of transportation. You can maybe integrate physical activity into your job or into your housework. So we think about a more active living approach, which gives us, again, more possibilities for intervention. So in an active living community, you know, things tend to be centered around the home, and then we talk about community design and having destinations. Because if you're going to think about active transportation, that means you have to have some place to walk to. So that means destinations. And so your community has to be designed with those destinations instead of without any destinations, which is what most of what we have built in this country over the past 50 years. Suburbs, single-use development. And so then we think about schools and work sites. Partly where they are they near where people live so they could walk, bike, or take transit to them? But also, what about the design of the place itself? The site. Is there adequate place for activity at the school? And then what about the building itself? You've got a world-famous architecture school here that's very focused, understands the relation to physical activity. So I think they would understand you actually might want to put stairs where people could find them, and make them open and pleasant so that you would want to take them. And if they're really on the radical side, they might put the elevators at the back of the building, so you have to hunt for those. Okay, just the opposite of how we've been building buildings, and essentially forcing people to take the elevator because you close up the stairs. And if we're interested in leisure time activity, we need to pay attention to parks and recreation facilities. And I'll show you why in a little bit. And then the last piece is the transportation system to link all of these places together. Because even if you have destinations nearby, if you don't have a sidewalk, or the only place, or if you're riding a bike, you're constantly competing with the same space with cars and trucks, well, that's not going to help you. That's not going to encourage you to walk or bike to those destinations. So transportation systems are really critical, and it's really incredible to think that in many cities, most cities, roads actually take up 20 to 30% of the land area. So they're a huge part of how we use our land. Okay, so this is an active living community. And you can see that, this is real estate, this is city planning and urban design, this is architecture and education and industry, and park and rec is private industry for recreation sometimes, and then parks departments, and then the transportation system. And you think, well, what do those places have in common? What do all those settings have in common? What do they have in common? Land, people use them or don't use them. The other thing they have in common is that they all affect health, but health departments and public health have no direct impact on any of these. So they're not in the purview of public health, but they all affect health, right? So this is why when we talk about environment and policy, we have to do it in partnership. Because the public health director cannot say, okay, we're building 20 new parks in our city this year. Cannot do that, all right? Have to work with the parks department, have to work with all of these different agencies and industries. So that all of a sudden takes it out of the realm of medicine and health and into community partnerships instantly, all right? So that's why, we wanted to bring people here from the community. How many of you do not work for the university? Okay, quite a few. Very good. Welcome. Okay, we'll try to make this relevant for everybody. So, actually, as we go along, I'm just going to kind of move through this. And if you have a question or comment, why don't you just, pop up your hand and we'll deal with that as we go. Okay? Anything so far? Comments, challenges, questions? Yes. 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 Yeah, I don't know about that, but dollars spent, budget for sure. Yes.
I just want to throw in one of your colleagues from the University of California. I heard say that there are no homeless cars in California. Every car in California has 5 parking spaces. Homeless people, yes.
We take care of our cars. We value our cars. Oh, that's a sad state, isn't it? Sounds like a Dick Jackson quote. Okay. Yeah. Okay. Dick Jackson, I'll give him a little plug. We just had a smart growth meeting in San Diego. He was there promoting his public TV series on designing healthy communities. So you look for that on your public TV. If it's not on the schedule, call him up. So it's all about this kind of thing. So I want to go through, give you a little bit of evidence and what we need to know in each of these settings. Most of them, maybe we may not get to schools, but communities. How we build communities makes a huge difference in our lives. And so walkable community. Mixed use, meaning you got destinations near where people live, connected streets so it's convenient to get to, and dense enough so it supports local shops and services. And this is the most walkable community in America, which is obviously Manhattan.
The ones that are a little bigger, they probably need an assistant.
This is not so walkable. And where is this? Everywhere. That's right. This is everywhere. So I like this picture so much is because you can, it's like what you were talking about. You can see where the cars live. You're not sure how the people get into these places. And huge amounts of asphalt, which causes its own environmental problems. One of the things that distinguishes suburbs is they're required by law in most places to be residential only. So by fiat, the communities are designed so that you may not walk from place to place unless you have a whole day to do it. So it's really zoning in most places is a policy that has direct impact on prohibiting people from being physically active, at least for transportation. On the other hand, we'll see. Look, they've turned this into a basketball court. See, they've got two basketball hoops here. So it's actually, it can be a recreation area. If you're 12, exactly. Exactly. So I want to go through some of the components of walkability here. So we'll start with residential density. So what do we know from the research? One is, well, density is a component of walkability. It seems to be required for economic viability of mixed-use developments. In many studies, it's related to active transportation, but density has a bad reputation. And so density is often a political barrier to walkable developments. And so what do we need to know about density? About, well, what are the critical levels of density for physical activity and maybe for different subgroups? And then how to mitigate the objections to a density. Here's some data from a paper we're trying to get published right now. And over here is basically a list of environmental characteristics based on a survey. So we surveyed people in 2,000 people in 2 parts of the U.S., and they rated their neighborhood on these factors. And this is the relationship on the numbers of the relationship to neighborhood satisfaction. How much you like your neighborhood. And so the ones that are significant have the stars by them, and almost all of them have the stars by them. The bigger the number, the stronger the relationship. So the better the aesthetics, the better the safety from traffic, the more you like your neighborhood. Well, that's kind of interesting. So all of these are positive except for one. Residential density is significant and negative. So you might like everything else about your neighborhood that's on here, but you don't like the density. So this is, and if you've ever been involved in anything related to development, you say, well, okay, we want a new development here. How dense is it going to be? And if it's denser than what they have now, they don't want it, right? So this is I think this is an important research issue. Okay, let's go into mixed use. What do we know? It's an essential component of walkability if you're going to have access to destinations that you can walk to. And it's related to active transport for adults and youth. In a review that we did recently on built environments and youth physical activity, it was one of the most consistent correlates of activity in youth is mixed use. But there's a lot that we need to know. What are simple indicators of mixed use? Mixed use, it can be measured in a lot of different ways. The data are often hard to come by, so it'd really be useful to have a simple measure. And maybe walk score is that use. How many of you know about walk score? Okay. Well, you can, if you look up walk score on the internet, look up your address, it will give you a walk score between 0 and 100. Right? So it's built on mixed use and access to destinations. So that's available to everybody. What are optimal levels of mixed use? Maybe not just minimum, but optimum. What are critical distances by subgroup? How far will women walk to the store? How far will older people walk to the store? I think those are things we want to know. Which uses drive walking for various subgroups? So if maybe different people in different groups are going to be interested in different uses. Food is probably relevant for everybody. Bookstores, not for everybody. Coffee shops, not for everybody. And so if we were really building a community that stimulated walking for everybody, we'd think about how to attract all subgroups to get out and walk. Skip that. Connectivity. How connected is the street system? Also an important component of walkability. And of course, in the suburbs, streets are not connected. You don't have direct distances. They're looping all around. It's easy to get lost. On the other hand, we find that with kids, in our review of activity in kids, connectivity had as many positive associations with activity as it did negative associations with activity. So that's kind of interesting. So I think what we're seeing with kids is that kids can play in a cul-de-sac, as we saw on the picture, but being in a disconnected neighborhood discourages them from walking to school, right? So it can have different functions even within the same population. So what do we need to know? What are the best simple indicators of connectivity? What are the effects of pedestrian connections in cul-de-sacs? So not so much that I've seen in this country, but in other countries, they'll have a suburban area and it'll have a cul-de-sac, but it's got a sidewalk connecting it to the next street or connecting that cul-de-sac directly to a shopping area. So you can't drive through it, but you don't care about that if you're driving or if you're walking or biking. So, but we don't have studies of that yet. So I think that's an interesting option for the U.S. And then how to balance transportation negatives and recreation positives for kids. Okay, and then pedestrian design. And this is often indicated by floor area ratio. And let me explain that quickly. That is the relation of the building square footage to the land square footage, right? So a high ratio means it's highly walkable. Because if you've got a block and you've got buildings up to the sidewalk around that whole block, as you have in an urban area, and it's 1 story, that's a floor area ratio of 1. Building square footage is the same as land square footage. If you got a 2nd floor, that's 2. 3rd floor is 3. If you go out to the suburbs and you look at a Walmart, you got a giant store, but if you got a more giant parking lot. So the building is only taking up 25% of the lot. So your floor area ratio is 0.25. So the lower, if it's a lower floor area ratio, that generally means it's automobile oriented. They're expecting you to drive. And so what we find is that this FAR reflects both mixed use and pedestrian design, right? So it's designed for pedestrians, but typically these are in mixed use areas. But pedestrian design is rarely studied. And we're doing some work internationally, and whereas other countries have most of the other data that we just talked about, none of them have the data that's required to indicate floor area ratio. So we're not able to study this internationally. And I'm going to show you some data that in one of our studies that floor area ratio is the strongest correlate of total physical activity. So what do we need to know? Do FAR results generalize to other sessions? And are there other indicators of pedestrian design that are more available in data? And I'm not sure. That's certainly a question. So this one is a little hard to see. This will be published in hopefully just a couple of months, few months, in Medicine, Science, and Sports and Exercise. And so what we're doing here is we're trying to predict total physical activity as measured by accelerometers. So we put these little devices on their waist for up to 2 weeks. So we have a very good measure of actual, not reported physical activity. Yeah. Moderate to vigorous physical activity. Yep. And so we're looking at the relation of all of these factors, demographic factors, psychosocial variables, and then environmental variables. And this column here, this V star SD, that's a little obscure, but basically what this is, it's the number of minutes that are explained by each of these variables. So age, it's actually each year of age is related to each year that you age, you do 3 minutes fewer minutes of activity. These are adults, yes. They're about 2,200 people. Children, yeah, a different thing. This shows that men did about 8 minutes or 7.5 minutes more activity than women, and on and on. And then we get to psychosocial variables. So these are things that we've been measuring. And you can see these are all the significant ones. There's quite a few significant ones. but they're really explaining 1 to 5 minutes of activity per day. And then the only environmental variable that came out in this analysis was retail floor area ratio. And let me explain this to you. So the 0 category means, and this is retail floor area. So we only looked at this for retail areas. And if you had no retail within 1 kilometer of your home, we used you as the comparison. And if you had, if the floor area ratio was very low, then you did small amounts, very small amounts of activity. It wasn't that different from 0. So 0.33, again, is automobile oriented. This is more your Walmart or strip mall. But if you're getting from 0.33 to 0.67, people that had that kind of retail around them, they did 4 minutes more physical activity a day. People that had the highest floor area ratios did almost 7 minutes per day more physical activity. And you think, well, 7 minutes per day is not that much, but that's 50 minutes a week. And you multiply that times a year. You multiply that by the 20 years you might live there, and it's a pretty big amount. And the other thing that's interesting, some of the early studies on environments came out and said, yeah, environment is related to activity, but it's really weak. And psychosocial variables are much stronger. Well, you see, we didn't really see that. Some of the psychosocial variables were quite weak, and the strongest psychosocial variable, barriers to activity, were not as strong as floor area ratio. So we're seeing that environments, if you do the study in the right way, really have a big impact. Yes? Surveys, we have standardized surveys that we've been using for years. It's your confidence that you can be physically active. That how confident are you that you can go out and do physical activity 4 times a week, for example. Mm-hmm.
Yeah, how did you measure barriers in that context there, psychosocial?
Yep, it was questions like how often does a lack of motivation keep you from being physically active, or a lack of places to go, or a lack of somebody to be active with. So it's a wide variety of things that we could.
Internal barriers?
They're all reported. They're all reported and rated. Some of them were internal, like motivation, or I'm just not interested. Some of them were external, I don't have a good place to be active. So a variety. Yep. No. This was actually measured with geographic information systems, with, based on actual data on building size. Yeah. Okay. Yes, ma'am. Actually, I took that out because there was too much in this table. But economics was important, and you see, education also is important. Yeah, yeah, we did have economics, but I took out some variables, several other variables that were in there, because I wanted to highlight, this thing about pedestrian design seems to be important. Yep. Yeah. Okay. Yeah.
Highest education. The one, like the first one, less than high school, 1 point. So then you have some high school versus no high school, and exercise, you have physical activity of almost 2 minutes more.
We're comparing these to graduate degree. We didn't have very many people with less than high school, so that's probably not very reliable. And so probably what's going on here is that you see the highest one is with people with high school education, and that is very likely their job activity, right? So their occupational activity is going to show up there. Yeah. Okay. Okay, good point. We only had 2 locations in this study, and Maryland and Washington State, and we had the same findings there. But there's a recent study that is done all over the country, and they looked at the percent of people who walked and biked for commuting to work, because you can get that from the census, and they related that to, and they found that those people in states or cities with high active commuting to work, people in those areas were more likely to be physically active. They were less likely to be obese, and they were less likely to have diabetes. Okay, so it does show not just your own. It shows that the state and the city matter. Yeah, because that's where the policies are made, isn't it? Yeah, so they tend to be. So I'm going to skip this. So we put all this into walkability index, and so I want to just show you some data here. This is from the same study that we did in 2 locations, and when you look at an overall walkability index that includes all the things we've talked about so far, we find a 5 to 7 minute difference per day, pardon me, in moderate to vigorous physical activity, and we found that the same pattern in low income and high income neighborhoods. All right, so this is good news, that if in a low income neighborhood is walkable, the people there get some benefit. It doesn't look like quite as much, but it's a similar finding. And we found this is recent data unpublished from teens, so the same type of study, and we found almost exactly the same thing. You know, this is like a 7 minute difference here per day. Again, 50 minutes per week, and similar findings for low income and high income. So this is good news. So walkable neighborhoods seem to work for teens, adults, and we have similar data for older adults. Yes, ma'am. It gets a little more complicated. So it gets a little more complicated. But generally yes. But there are some differences that I don't have in my head. So somebody's working on putting together those findings by gender. Yeah. And okay, so walkability seems to be pretty important, but that doesn't describe everything that there is about a community that might be important for physical activity. Where people are starting to look at patterns of attributes or more attributes. And what we know so far looks like the more attributes that you include in your study, the more power you have to explain physical activity. And what we need to know is, well, what are the best ways of assessing patterns, and how generalizable are these patterns? Do they work across populations? Do they work across settings? So let me give you a couple of examples of how people are studying these patterns. Here's a simple way. This is from a study that we did in 11 countries. We just had 5 or 6 environmental variables that we asked about, the same ones basically that I showed you. And so we just gave each person a score for the number of favorable environmental attributes that they had. And to me, one of the most interesting things is that if you had only 1 or 2 or 3 of these attributes, it didn't make much difference to your physical activity. This was not significant. So if a policy maker thinks, oh, I've got a suburb way out in the hinterlands, but I want to make it walkable, so I'll just add sidewalks. Problem solved. No, problem not solved. Okay, you've only got one good thing. So you got to have, looks like you got to have the whole package. And this is to me fairly compelling evidence. 11 countries, about 8,000 people. That it's a whole package you've got to design kind of a community that supports activity. You can't just retrofit and do one little thing and say, okay, now it's walkable. Here's a little more complicated way to do it. This is something like 11 or 12 attributes. Some measured, no, I think we measured all of these by self-report. So, or maybe a couple, no, all of these by self-report. And then we found 4 different patterns. And you can see the patterns are in the different colors. And so you can see they varied a lot on residential density. They varied a lot on this, access to transit as well. And so, you find different patterns, some quite walkable, some very unwalkable, and a couple of patterns in the middle, right? So we gave them names, but then we looked at how these related to, and by the way, we found very similar patterns for the Seattle region and for the Baltimore region. They were very, very similar. And then we looked at these patterns in relation to outcomes. So if we just compare the low walkable without transit to, which is the, kind of the least activity friendly, to the high walkable that had a lot of recreation, which is the most activity friendly. Remember, when we just looked at walkability by itself, we saw about a 5 to 7 minute difference in adults. Well, here we go from 32 to 41, so that's about 9 minutes, almost 10 minutes difference. So it's actually a little bit stronger. With more attributes, you're explaining more activity. And we saw huge differences in transportation walking, in leisure walking also, really big, and then in body mass index, we also saw a bigger difference than we did just with walkability. So this is about almost a 1.5 BMI, so that's about 9-pound difference. So that's quite substantial. Yes?
This looks like when in each of these, for instance, transport water, right?
Yes.
It goes up from each one, right?
Yes.
From 9 to 7.
Yes.
But the BMI seems to not vary from one of these modes or profiles.
Not enormously, but there are differences, right? So so this difference of 1.5 points is pretty substantial.
Oh, right. You want that to go down.
We want that to be going down. So lower BMI in the high walkable or activity friendly is what we would expect to see. Let me show you another study that hopefully will be accepted soon. This is a study of children and 6 to 11-year-old elementary school children. And we selected these children from neighborhoods.
Okay, let me finish this email and I'll come to your office.
Kind of high and low.
Let me finish this email. I'll be right there in your
and
office.
high and low for healthy nutrition. So let me explain what those are. So a good physical activity neighborhood would be walkable and have a nice park nearby. A low physical activity would be not walkable, more suburban, and no park at all. Okay? Then a high nutrition that would be good for nutrition would have a supermarket nearby within at least 1 kilometer and not very many fast food places. Whereas a poor nutrition place would have a lot of fast food, no supermarket or no produce market. Okay? So then we have a kind of this 2x2 a design. So we're looking from low physical activity, low nutrition, to high physical activity, high nutrition. Okay? So what we're trying to do here is define, is there an obesogenic environment? Okay? So so these are carefully measured BMIs of children aged 6 to 11. And what you can see is in the the most obesogenic neighborhood, we find the highest obesity. 19% are above the 95th percentile. So these are really obese kids. And in the least obesogenic neighborhood, and that was about 14%. Okay? So that was, no, 11%. It's over here. So this is 11%. So that's almost half the rate of obesity. Yes, control for SES. Yep. And even, this surprised us. When one of the reviewers for the article said, oh, you have to also control for the mother's BMI. And I thought, well, that's going to wipe out everything. That's a whole genetics and environment. But we actually did it. We controlled for the mother's BMI, and these held. You still see those differences. And we measure the mothers, we basically see the same thing. The other piece I want to just have you notice is those in the middle, they either have good nutrition or good activity environments. They both seem to be important. It's not that one seems to be important and not the other. Yes, sir? I don't see that here. I don't see that in this one.
Maybe I'm not reading right, but the lower nutrition seems to be lower than the one left.
Yeah, but that's really tiny. I wouldn't interpret that. I think that's a difference that's not really a difference. Yes? We control for neighborhood income, right? We can control for neighborhood income and or personal or household income. Stays the same. Real estate taxes? Okay. All right. Well, we'll have to, that's something we haven't looked at. So I think this is really interesting. But defining these neighborhoods was extremely difficult. Very difficult. It was hard to get the data. It was hard to, we really wanted to define the nutrition, a good nutrition neighborhood as it had a supermarket and no fast food. Guess what? Couldn't find that. That's right. Didn't exist in our areas. Do you have a question?
Yeah, with the high nutrition, so it's just fast food and supermarket?
Yes.
Any other parameters?
That's all we included here. Just including that was difficult enough. The selection was made based on census block groups, which are pretty small, and then I think we looked at some distance from the block group that was at most 1 kilometer. So these are pretty small. These are pretty small areas. So I think this is an interesting thing. How we doing on time? We need to wrap up. Yeah. Okay. Thank you. Okay, I want to talk about bicycling. Because I think that bicycling has a tremendous potential to promote activity and get cars off the road, reduce greenhouse gases, reduce air pollution, because you can go a long way on a bicycle. And so what do we know? What do we know about promoting bicycling? Single interventions are not effective. So if you put you paint a bike lane on, doesn't seem to do much. If you just have a bike sharing program, doesn't necessarily do that much. If you put up sharrows or share the road, doesn't do very much. So even a separated bike path by itself, most of the studies show don't do very much. But based on case studies, comprehensive interventions implemented over some time can be effective, and I will show you that. What do we need to know? Which bicycle facilities are most effective in attracting new cyclists or commuters? Okay? Not just getting the guys in Lycra to bicycle more, right? We know who they are. Yeah. They have no fear. That's not the rest of us. What are the most cost-effective combinations of approaches? And we need to quantify the co-benefits of bicycling. I mentioned this study. This is a very interesting paper by John Pucher, just published last year. Again, this is the percent of adults in a state who commuted by walking and cycling. And look at these correlations at the statewide level with meeting physical activity recommendations, with finding lower obesity and lower diabetes. These are really, pretty striking. Pretty striking. And they found the same thing whether they use 50 states or the biggest 47 cities. Okay, let's see. This to me is even more dramatic. This is an international study. Again, John Pucher. This one is not published as such. But here's a bunch of different countries. And if you look at the USA, we're by far the lowest in trips by walking, cycling, and transit, and we're by far the highest in obesity. And just look at this, look at these lines, and look at the differences. From Denmark, they're obese, and Switzerland, 15 to 20%. Their obesity is, down at 10%, and their transit use is up at 55%, 50%. Okay. Now this to me is really the potential power of policy and environmental change. And you have to go outside the country to really see what's possible. But I think this is really dramatic. And was it always like that in these places? No, it was not always like that. In fact, I recommend you to go on YouTube and look up Copenhagenization. And it's an interesting CNN report showing that in the 50s, Copenhagen was clogged with traffic. They had said, okay, we're going to have everybody drive, and it was just packed and gridlocked. And then they said, okay, we're going to change that. We're going to bring in bicycling. It took them 30 years to do it. And now they have a new problem. They're having congestion on their bike lanes, and they're having to expand their bike paths. How about that? New bike paths. Not expanding the freeways now, expanding the bike paths. So check that out. Okay, here's something that I think is very instructive. These are the case studies. And these are all cities around the world that started out at about 1% of trips by biking. And that's about the US average, 1%. And over some time, look what's happened. Okay, now London, this is just like 3 or 4 years, right? But they're bumping up. Barcelona, going up. Paris, Bogota. And look at this, Minneapolis and Portland, all right? And Portland's up to 6%. I'll talk a little bit more about them. But Minneapolis, look, they're up to 4%. I like to embarrass my fellow San Diegans by saying we live in a biker's paradise here from the weather, but Minneapolis has 4 times as much bicycling as we do. It ain't the weather, it's the policies, and it's the infrastructure that they've built. Okay, I find this extremely encouraging. Okay, a little bit on parks. You can build a park, not put much effort into it, or you can really try to make it activity friendly. What do we know about recreation facilities? Parks are consistently related to total activity and active recreation in adults and youth. There's some evidence about the importance of access to private recreational facilities. And if you have parks and trails in your neighborhood, you have higher real estate values. So they're good for economic development. What do we need to know? The role of trails in active transport and active recreation. Trails should get double benefit, double credit if they're in the right places. What's the optimal distance to parks for various subgroups? In other words, how far will a mom take a little kid? How far will an older person go to a park? And what are the most important park characteristics for attracting people to come to the park and then be active there? So here's a study. This is a national study of adolescents. This across the bottom is number of recreation facilities in the neighborhood, whether it's a park or a private facility. This pink line is physical activity. Okay, a likelihood of doing a lot of physical activity. The blue line is the likelihood of being overweight or obese. Not all studies show it this cleanly, but this is a big national study. This shows that this is based on observation of how active are people in various parts of the park. And you can see that there's some variation there. Playgrounds, basketball, racket sports, pretty active. Baseball, not so active, right? But you think about how much space do baseball diamonds take up in parks? Huge. Oh, we may need to think about that. Okay. I think I'll stop there and see if there's some questions, discussion. Yes, ma'am.
So in the communities where they increase biking, have there been concomitant increases of those are pretty.
Yeah, they are big increases, and I don't know. I don't know that anybody's put that together, but that's an excellent question and something that certainly could be done. Certainly could be done. I will tell you that in most of those places that they show an increase in cycling, they also show a reduction in cycling injuries. Yes? Maybe I don't know. I don't know the crime rates. They change over time. Let me address that in two ways. Traffic safety, very important. But one of the main reasons why parents won't let their kids walk to school, worried about traffic. One of the main factors that dictates where people bicycle, got to stay away from traffic. Okay, traffic is very important, right? Crime safety, that's a difficult question because you would think, well, it's pretty obvious if you live in an unsafe neighborhood due to crime, you're not going to let your kid go out, you're not going to go out. Well, we just don't see that. The literature is extremely conflicted there. Some studies show it, and just as many studies don't show it. So I think crime is really difficult. And we're working with a criminologist right now, trying to think better about crime, because you think crime is worse often in low-income neighborhoods, but people in low-income neighborhoods walk more for transportation, and that's probably because they have to, right? Whether there's crime or not. So I think it's a complicated issue, and the research has not been helpful so far. Sorry about that. Yes?
I think the crime question is a little bit better parts how far out of your care you go, or how much extra danger you put yourself in. Those same people that use public transport or walking because they have to also know that neighborhood a lot better.
Yeah.
Specific micro areas
Yeah.
to stay out of,
Yep.
people that are most likely to get into trouble, versus if you live in a high-income neighborhood and they put a bike path straight to the low-income neighborhood, you're really going to use it to be more physically active. You're risking not knowing where you are as well as people.
Yep. I think those are good points. Criminologists would say, yeah, people will have strategies of avoiding a crime hotspot or going at a different time of day when it's not Yes.
Miami Park and Recreation Department put together like a 40-year plan, 2048, which takes different parts of the city, making streets that have high traffic, how to put in a berm separating traffic from the walk area, widening the walk area, lines of trees, to get people to bike and walk in those busy areas that are difficult to walk along, sunny,
Yep.
you know,
Sure.
rain, shade, nothing
Sure.
there. So you might take a look at that to see what that plan looks like. They've taken different streets, different parts of town to be able to figure out how to make them more reactive.
That sounds great. Yeah, I'm really sold on linear parks really generate activity. And in one study, the parks that had a trail had 26 times more physical activity than those that didn't have a trail. You know, because if you have an open area, you could play soccer, or you might just decide to take a nap. But you're probably not going to take a nap on a trail or a sidewalk. Yes, ma'am. No, no. You know, I would say to have to develop a plan and devote some money to it. And I would show them this slide. This was published just last year. This is back to Portland, and this line is how much they've spent on bike infrastructure. Okay, the solid line. This bottom line is savings in healthcare cost and gasoline. Okay, and so they showed these data to the city council, about right here, and they said, oh, what we're investing in promoting bicycling is saving us money in healthcare that's helping bankrupt our city. So we're going to we're going to triple our investment in bicycling infrastructure so we can save more money. Okay? Now, at some point at 2030, it starts to look a little funny, but there's always big distance between those. So this is pretty real. The way I talk to policymakers, if you look at what's driving the national debt, right? One of the biggest things is Medicare, healthcare. One third of Medicare increases are due to obesity. So it really makes sense to start investing in things that can reduce obesity, which we haven't done that much of. CTG is starting to do that. Community transformation has. So, I think there's an economic argument to be made. And this is not property value. So, walkable neighborhoods retain their value better. Yes?
Neighborhood hardware stores or things. Now with corporations pretty much dictating our consumer life, and the Walmarts and the Kmarts and the Home Depot, and putting the small little businesses can't compete.
Yeah.
So I mean, at a whole nother level, you had this whole corporatization of the country, and of course, with part of you mentioned at the beginning the Industrial Revolution, it created demand because now they could make a lot more than what people need, and of course came advertising and that. So that whole dynamic that really and brought up a culture of consumers, not of people living and interacting in communities and sharing resources on a regular normal level.
Yeah, good point. Yeah.
It appears to me that the least expensive way to increase physical activity is by allowing people. It doesn't cost anything, and in fact, it brings in revenue.
It costs the city less, much less, because they don't have to put as many sewer as much, as many roads. So it costs them much less to have mixed use, and it makes them more money.
Right.
Yep.
And it costs, it actually, there is no investment in allowing private sector.
Yeah. Yeah.
Mixed use.
That's right. And they make more money too. So it seems like yet virtually every city prohibits mixed use. Yes.
How about something like big streets? Like, have there been analyses before and after, like this kind of thing, where new investments have been put in?
Not directly. This is something. We haven't really had the research on that. So that's something we need to study. But certainly we know that sidewalks are good. We know that accommodating bicyclists is good. We know from a study in Portland that the more protected the bike facility is from traffic, the more people use it. And particularly women, the more that women will use it. Women are not impressed by painting a line on the street, okay? Especially if they have the kids with them, But separate them from traffic, and there's a lot of ways of doing that don't cost much, but that often do require taking back a travel lane. So that is my indicator of cities that are serious about bicycling. They take traffic lanes. In Miami, no. Okay. Okay. Wow. Fabulous. And you got good infrastructure there for it. Yep. 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 Very good. Very good. Okay. So I think we will quit. Thank you for your attention and staying.